So good afternoon, everyone. Welcome back to our health talk, our Monday health talk. Okay, I understand there's a lot of newcomers today, so welcome to those who actually join us for the first time. So just to make a quick introduction, this is actually a health talk. It's actually a part of the Silver Click series, which is organized by Radima CC and in collaboration with SGH Community Nursing. So thank you all for joining us today. And then just a quick intro as well. We also do have this health talk with Silver Click Radimas at every Monday, 2 to 3 p.m. It's a 1 hour health talk. And if you would like to know more about other Radima Silver Click activity, do actually drop by their Facebook page, or you can check in with Radima CC. They have a lot of other activities that is planned out for seniors throughout Monday to Sunday. Yes, so without further ado, we will actually be passing for the health talk today to Staff Nurse City and also our care coordinator Nazura, which will be sharing with you more about aging and eye care. Yep, thank you.
Okay, thank you, Felicia. Can everyone hear me?
Yeah.
Can? Okay, can. Thank you. I would appreciate if you all can mute your mic. If further questions later on, then after we finish the meeting, then we can answer all your burning questions, okay? Okay, so good afternoon, everyone. Thank you for sparing a bit of your time to attend to our health talk. So my name is Community Nurse Siti, and with me today is my colleague, Senior Care Coordinator Nazura. So today our health talk will be on aging and eye care series 1. And before we start, unmute yourself. If can anybody tell me why is it important for us to take care of our eyes when we get older? Just maybe one answer or two answer. Anyone can unmute or maybe type in the chat.
Question again, sorry.
Why is it important to take care of the eyes when we get older?
Wait, I want to say, without our eyes, we cannot see anything, no? So we are blinded, and then cannot do anything. Very important, the eyes are very important part in our body.
Okay, thank you so much, Miss Sharon. Okay, thank you for the answer. So let's go through together in the next few slides. Okay, so firstly, let's discuss our outline. It's introduction to aging, the common eye problems in elderly, the eye care tips, and lastly, the take-home message. So I'm sure everybody knows what is aging, right? So aging means you get older. So when you get older, the body function might gradually decline, and in this case, we are talking about the eyes. So why do we think that it's very important to go through for the eyes with our seniors? So in Singapore context, with increasing life expectancies and low fertility rates, the proportion of Singapore citizen population aged 65 years old and above is rising rapidly. So according to population.sg, in 2016, the ratio between working adult to older adult aged 65 and above is 4.7:1 older adult. In 2030, estimated, however, will be 2.3:1 older adult, which is a decline drop. And by 2035, it was expected that 32% of Singaporeans will age 65 years old and above. And therefore, it is important for us to empower our seniors to live well and age well in the community. And this is why we think eye care is very important, and we will share in the next few slides. So, like previously, one gentleman asked about cataract. So what are the common eye problems in elderly today? So today we will be covering on cataract, glaucoma, diabetic retinopathy, and age-related macular degeneration. Now, let's go through about cataract. Cataract is a common eye problems in our elderly. So what do cataract do? As you can see from the picture, we have a normal eye and we have the eye with cataract. So what's the difference between a normal eye and a cataract eye? Okay, for people without any cataract, our lens will look like this. However, when people with cataract, it is like there's a cloudy blocking the lens. So this is how they will perceive their eyesight to be. That's why some patients who actually have cataract will say that, oh no, Missy, my eye, I feel like there's a thick layer above my eye and I could not see properly. And this is what they will normally will say, I have hazy vision, or I seeing blurred things everywhere. So why again? So the answer is cataract is due to clouding of the natural lens in the eye and is mostly common due to aging. And it is also one of the leading cause of blindness. And this could be caused by the use of medications such as steroids, smoking, trauma to the eye, and prolonged UV exposure. Okay, other symptoms could be, finding lights too bright or too glaring, finding it harder to see in dim lights, or you can see brown or yellow tinge of vision. When you see vision, you say that I see like a yellow thing in front of my eyes. It could be that you're having cataract as well, and you're experiencing double vision. You're seeing a circle of light along the brightness, meaning we call it halos around bright lights, meaning around the bright light you see like a small circular of small lights. Okay, but however, cataracts are usually not painful, but and rarely cause irritation or redness. However, in advanced cases, it may be associated with raised eye pressure, leading to symptoms of pain, nausea, and vomiting. So next one, we shall go through diabetic retinopathy. Of course, when you all know the name diabetic, this is a diabetes complication. So it affects the eyes. And that is one of the reasons, every time you go to a doctor or polyclinic or you see a community nurse, she always tells you to control your blood sugar. So one of the complications of diabetes is diabetic retinopathy. So what do it do? It is caused by the damage of the blood vessels at the light sensitive tissue at the back of the eye known as the retina. So what happened? As you can see, the small blood here, you see all the small blood formation. Okay, so what do it do? It starts when the sugar blocks the tiny blood vessels. As you can see, it blocks the tiny blood vessels that goes to your retina and causing them to leak fluid or bleed. Okay, so the eye has a very special mechanism. When a blood vessel gets blocked, what the eye will do is to compensate, means to add on. They make up with tiny blood vessels to, because the eye need blood to circulate, right? So if blood vessels, if these small tiny blood vessels is blocked, so that's why the eyes needs the blood flow to the eyes, right? So that's why they will compensate by building more small blood vessels that doesn't work well. So therefore, we actually tell our diabetic patients, please get a comprehensive dilated eye exam once a year. So far, okay, for early stages of diabetic retinopathy, normally there are no symptoms, but some may say that I cannot see far, or maybe I cannot read, and these changes might come and go, and it's not always constant. So however, in the later stage, right, you can see blood vessels in the retina start to bleed into the eyes. When we see people with eye that look like, people say, hey, your blood vessels of your eye burst. So that could be one of the reasons, could be diabetic retinopathy. But however, you can see dark floating spots or streaks that look like, like a spider web kind of thing. That is the tiny blood vessels that try to compensate for the eyes. So without treatment, the bleeding can happen again and it gets worse, causing scarring. So what are the treatment involved? Some treatments involved will be steroid injections, laser treatment, or eye surgery. So next one that I'll be talking about is another common eye condition is glaucoma. So glaucoma is an eye condition described as a loss of vision from damage to the optic nerve due to raised eye pressure. So what do optic nerve does? Optic nerve actually, they send messages to the brain. So that's why people with glaucoma, they always say that, increased eye pressure, right? They always say, I always have headache, okay? Because these optic nerves are sending messages to your brain and say, hey, look, something is blocking there. Okay, so what happens in glaucoma, as you can see, for a normal eye, the drainage fluid, okay, when we cry or when we feel upset, when we cry, the normal eye can easily flow. But in glaucoma patients, right, even though some may have eye teardrop, but they still feel pressure in the eye. And then from the pressure, they will get headache. So this is one of the common eye problems in elderly. The next one, which is not so common, is age-related macular degeneration. It is an eye disease that blur the central vision. So this happens when aging causes damage to the macula. So what is a macula? The macula is center. Okay, it is part of the retina that controls sharp, straight ahead vision. And of course, patients with this condition is not advised to drive because why? They affect the central vision of the seniors itself, okay, or the patient, because you cannot anticipate what you cannot see far. That means you cannot anticipate accidents, right? Okay, so what is it? It commonly affects patients with the age of 50, and this again, who is at risk? People who have family history of age-related macular degeneration or smoke. And damage, once damaged or having this, it is irreversible. So again, we stress again, comprehensive dilated eye checkup at least yearly. Okay? And who is most likely to develop this? People who eat high in saturated fat, they are overweight, smoke cigarettes, over 50-year-old, have a history of hypertension, have a family history of this, having a heart disease due to high cholesterol. Okay, lastly, which is a very, very, very common eye problems in not only elderly, sometimes also people in mid-40s, is presbyopia. It is the gradual loss of eye's natural ability to focus. So normally becomes noticeable during the mid-40s and continue to worsen around 65 years old. Okay, so why do we think eye care is very, very important? Okay, if you have again, like me, Sharon mentioned previous just now, if you have difficulty, if you cannot see properly, okay, you have reduced visual field, it makes you very difficult to walk or even navigate yourself. And then on your foot placement might also be impaired. And then what happens if you cannot even step properly or walk properly, you cannot even see any hazards, you tend to fall, right? And when our seniors fall, it's very, very dangerous. So in Singapore, we have about 27.9% of elderly age 65 years old and above fall due to poor vision. So I'm sure you all know the tips to prevent falls, right? That was covered previously by my other colleagues. So for recap, let's go through again. So the 5 tips to prevent fall is keeping your home safe and neat, keep your bones strong, exercise regularly, wear well-fitting and non-slip shoes. And lastly, what we're going to go through today is go for regular eye checkups. Almost everyone will experience natural changes in their visual acuity as they age. As you enter your 60s, you may notice that you need more light to see. You cannot see some colors properly, especially for blue and green. And then you experience difficulty focusing on things. And you even have trouble adjusting to glare, right? So what do? Let me pass to my colleague Nazura to talk about what can we do to help with our eye care.
Hello. Hi, I'm Nazura and I'm going to talk about eye care and practicing good personal hygiene. For practicing good personal hygiene, step 1, use a clean towel to wipe your eyelids well after you wash your face to prevent infection. Do not use a shed towel or your hands to rub your eyes. Next slide is adopting healthy lifestyle. By monitoring your blood pressure and cholesterol levels, and best to avoid smoking to reduce risk of getting eye problems. Exercise regularly and eat well-balanced diet, and to make sure to get adequate rest to relax your eyes. And go for eye examination yearly, and get more frequent eye checkups if you have diabetes. Next slide is for making changes in your life to see better. Adequate distance between your eyes and the TV. The bigger the screen, the further you should be sitting away from it. Hold the book that you are reading at about an arm's length away from your eyes when reading, while the computer screen should be about 50 cm away. Relax your eyes every half an hour while reading or using the computer by looking at some distant objects. So what are the adequate nutrients for healthy eyes? Antioxidant vitamins help to maintain healthy cells and tissues in the eyes. Vitamins A, C, and E can be found in many different sources of fruit and vegetables, such as oranges, kiwis, grapefruit, dried apricots, tomatoes, peppers, raw, and carrots. Green leafy vegetables, including kale, spinach, green peas, green beans, and Brussels sprouts. They can also be found in nuts, seeds, dairy products, and eggs. These are only a few of the food types in which antioxidant vitamins are found in. So when should I see a doctor for my eyes? When you have persistent sharp eye pain, feeling burning sensation in your eyes, experience oversensitivity to light, or see halo or rainbow lights, when you experience cloudiness in the transparent part of the eye, and when you encounter sudden loss of vision, when you have discharge or crust or on your eye, and when you see a sudden large appearance of floaters in your eyes or black spots, and when you have abnormal growth in the eye or on the eyelid. Next slide is what to do after seeking help. Ensure safe and home environment. Use a market label medicine bottles and pack it clearly. Read labels with magnifying lens. Get your family to help with the use of the medication pill box, and avoid weightlifting and high impact exercises such as aerobics. Next slide is, do you know how to apply eye drops and ointments correctly? Let me hand over this to staff nurse Siti to show you the video. Hold on.
Having trouble applying eye drops? Eye drops is one of the most common medications for our eyes. It can be a little tricky in the beginning when you instill your eye drops. You may miss your eyes a few times, wetting the area around your eyes and wasting that precious few drops. Today, I would like to share with you an easy way to apply eye drops in 7 easy steps. This will ensure you a more hygienic and efficient way of putting eye drops. Step 1. Wash hands before applying any medication in the eye. Step 2. Tilt your head slightly backward and look upward. Step 3. Gently form a sac by pinching lower lid or pulling down lower lid. Step 4. Squeeze the bottle of eye drop in the sac. Never touch tip of applicator to the eyelid or eyelashes to prevent contamination. Applying more than 1 drop will not increase the efficacy of the medicine, but may increase side effects. Step 5. Close the eye to allow absorption. Do not blink. Step 6. Gently wipe away any excess from skin around the eye with clean tissue.
Oh, sorry.
7. Wait for about 5 minutes between eye medications before applying the next eye drop. And
Okay. Okay. Thank you, Nazura. So, I'm sure not all of you have eye drops. What about eye ointment, right? The one that you need to put in the eye. So how does it go? Okay, so basically the principle is the same. Before applying any eye drop or any eye ointment, you need to wash your hands. Okay, wash your hands and then read the instructions on the label. The most important thing is to check for expiry date. Okay, if you use it's more than a month, please discard it, because eye drops can only be kept for 1 month, okay, after opening. But you know, some patients ask me like, oh, but Missy, only 1 to 2 drops still need to throw. Yes, after opening, maximum period of to keep it is just 1 month. So what do you do with eye ointment? So the principle is the same. Tilt your head back as per the video. Okay, wash your hand, read the thing on the label, ensure it's not expired. Tilt your head back. Okay, tilt your head back and pull down your eye. Okay, when you pull down your eye, so what do? you open the eye gel, right? You know, when you press a bit of the eye gel, okay, throw a bit of the tip of the eye gel, okay, because we are afraid, you know, when you open, you know, certain bacteria might go inside the cap, right? So you need to maybe press a bit, throw a bit of the medicine, and then pull down your eye, and then put inner to outer, okay, this lower part of your eye, okay. Then after putting down the eye, so what do I do? So after putting down the eye, immediately close your eyes. Close your eyes, do not blink your eye, okay? This is for absorption of the eye. And then take a tissue. During closing your eye, take the tissue and wipe away all the excess. And then you might ask me, I have an eye drop and I have an eye gel. So which one do I put first? Okay, importantly, put the eye drop first. Okay, for the reason being, eye gel take longer to be absorbed. Okay, and of course, waiting time for the next medication, like how the video goes, is to go 5 minutes later. So when you administer your eye drop, after you wipe the excess, okay, then you wait 5 minutes and then you put the eye gel. Again, closing your eyes, wipe away all the excess. Okay. So of course, again, after putting any eye drop or any eye gel, you might be temporarily blurred. So importantly is to avoid activities that require a visual ability. For example, driving, because you might be in an accident. If you cannot see properly, then how you want to drive properly, right? Again, you might not be anticipate probably the car in front of you or any accident or any passerby that come. Okay. So how do you store your eye drop, right? Okay, so number one, keep away from children. As you know, children are very, very curious people. They tend to take and play with whatever medications that they see. And to keep in a cool and dry place, away from direct sunlight, record the date open on the eye drop. This is the important one. Record the date on the eye drop, for the reason being, once opened, any eye drops should be discarded 1 month after opening. Okay. Some special eye drops like Salatan should be stored in the refrigerator when unopened. However, when they are open, they can be stored in room temperature. So what's the next important take-home message? After I went through the 4 common eye condition, as you can see, the most common ones is risk of people getting them is the most common one is smoking, people with heart problems, diabetes, and all this kind of thing. So all this can be prevented by regular eye checkups and adopting a healthy lifestyle. If you want to find us, our community nurse posts, we have 35 community nurse posts all over the Southeast region, in Teluk Blangah, Chinatown, Katong, Bukit Merah, and Tiong Bahru. You can also contact us at the number above and email us if you have any questions. Okay, our operating hours are 9 to 4 p.m. Thank you. That's the end of our talk. Any questions?
Yes. May I ask you, when I apply my eye drops, after the first eye, must wait for 5 minutes, so long?
Yes, correct. So Miss Christina, the reason of waiting the eye drop, okay, for example, if you have 2 eye drops, right? You apply the first one, you have to wait for 5 minutes. For the reason being, your eye need to be absorbed. If you put 2 together, right, in a span of less than 5 minutes, the drug will mix together and then it will, we are not sure what effect might come after that because there's 2 side effects, 2 different medications. So it's best advised as you put the drop 5 minutes apart for it to be absorbed better.
It means between the 2 eyes?
Sorry? No, if let's say, okay, for example, you put on the right eye, right? You put 1 drop on the right eye, then you wait, you put another drop on the right eye, right? So by the time the right eye will reach 5 minutes already, right? So you can add another second drop.
After I drop the first drop in my right eye, how about my left eye? Must I also wait for
Don't need.
I keep all my eye drops in the fridge. Is it okay?
Technically, of course, the most important thing is actually don't need to necessarily put it inside the fridge unless it's indicated by the label to put it inside the fridge. If not indicated to put it inside the fridge, there is no need to put inside the fridge. Yes, sorry.
But no problem, like if I put inside the fridge, I feel more safer. Is it okay?
Yeah, it's okay. There's no problem. Importantly, to discard it 1 month after using.
So sorry. Another question. I have a cataract operation about 2 years ago, but I find that my eyes always very strained when I read. Very easy to I feel like uncomfortable, very strained. Is it normal?
Sorry, very strained, is it?
Is it normal?
You need to take breaks, like how my colleague mentioned in between. You need to take breaks while reading, while watching TV, or while paying the phone. So you cannot read continuously. So if you think that you get very uncomfortable very easily, right? So try to blink your eye and then rest your eyes. Probably look at some greeneries at the trees outside the door, or outside the window, so that for your eyes to rest better.
If you don't mind, maybe another question. After the cataract surgery, is it okay? Can last for the whole life?
Sorry?
I mean, after my cataract operation, is it that's fine? That I no need to. I can. It can last for till I leave the world. Is it so?
Oh, sorry, Miss Christina, because the common eye problems, it comes with age. As the age progresses, we do not know what kind of eye conditions that we're gonna have. So even if you have a cataract and you have already removed it, at least probably now you have removed your cataract, and in few years down the road, I cannot advise you to say that whether it's gonna last until your end of life. So the best is to actually get a yearly eye checkup and a regular eye checkup to make sure to detect all these problems early.
Okay, thank you very much. Thank you,
Miss Christina.
Thanks.
Hi, CT.
Hey, hi, Lu Shuai.
Yeah, I think just now how to start the medication, the slide was not so clear. Do you mind, can you show us again?
This one?
Yes. Yeah,
Okay.
because some was actually on the logo.
Oh, okay. Sorry, can you see now?
Yeah.
Okay, can see.
Okay. So means some medication, if like Xalatan, if it's not open, should be put in the refrigerator.
Correct.
Okay.
Correct.
Yes, staff nurse, I want to ask you.
Yes,
I have this every day when I wake up, I have this discharge, is sticky discharge, and then also I have a dry wet eyes, and the doctor say I have entropina. Entropina. That one is inward eyelid. And asked me to go for operation.
Okay.
What is your opinion?
Of course, I will follow with the doctor's advice, because the doctor have already seek your medical condition. He himself has diagnosed whatever that you're having, and he has advised you to actually proceed with the eye surgery. So it's best that you actually follow the doctor's advice, and then hopefully at that point of time your eye could be better lah.
Another thing I want to know, how to prevent discharge from the eyes.
Okay, because you already have a eye condition, right? The doctor has already explained to you that you have a certain eye condition. So the eye discharge, right? We cannot totally stop the eye discharge, but I can teach you how to keep your eye clean lah. So meaning, you have to clean your eyes, wipe your eyes, don't let the discharge flow out, and then you have to clean it with a wet tissue, wipe your eyes frequently, keeping it dry. Yeah.
But the doctor asked me to apply the heat, heat on my eyes. The doctor asked me to apply the heat treatment on my eyes.
Heat treatment for your eye?
The stuff put on the two one stuff thing put is a current one, got this pad, iPad, and then run by current for I think 30 minutes or what.
So you have the equipment?
Yeah, I have the equipment.
Yeah, so it's best to follow the doctor's advice lah, because they already diagnose you with this certain eye condition. So it's best to follow what they actually advise you to do lah. Yeah.
I want to know why I got eye discharge.
the eye discharge can be a lot of reason. One of the reason is because you have that particular eye condition, and that could be the reason why you have the eye discharge as well. Yeah.
Thank you, Siti, and thank you, Sharon. Well, Miss Sharon, while you have other more questions, I believe that I saw one hand raising, Miss Esther, and also Mr. Yap also have a question earlier on as well. During his slide, he actually requested maybe we can invite Mr. Yap to share before we move over to Miss Esther for her next question. Would that be okay?
Okay.
Okay, thank you.
The question is, how do you go about
Sorry, Mr. Ya, I cannot hear you. So sorry.
how to go about selecting your specialist to
Sorry,
do?
sorry. Sorry.
Okay. I'm referred by the polyclinic to go to the National Eye Center.
Okay.
Now I want to select a surgeon to do my cataract. So how do I go about?
Oh, selecting a surgeon meaning you want to pay a private rate, is it?
Because I'm covered under insurance, so I want
Okay.
to make full use of the insurance.
Okay. Okay. So what I can suggest is you have a memo by the polyclinic, right, to see an eye specialist. Yeah, correct. So when you go to the eye center itself, you can tell them you book an appointment, but you tell the person, maybe you can call eye center appointment counter, and then you tell them that you want to book appointment under a specific surgeon. If you are aware of the surgeon's name, it will be better if you know the surgeon's name, and then you can tell them that you want to, is it possible to see this particular surgeon under this doctor? Yeah, I see this appointment under this doctor. Yeah.
But then, do you have a list of doctors for me to?
I apologize. I'm afraid we don't. Yeah, you need to you need to call eye center and ask them. Yeah.
Call eye center, the memo.
Correct. Yeah, correct. The main line is.
Check with them.
Yes.
See whether they can provide me with.
Correct. Yeah, see whether they can assist you on this. Yes.
Oh, okay. Then what are the what do you call? What are the percentage like getting out of the op? For cataract.
Yeah, sorry, I couldn't.
What is the percentage like to getting out?
I guess the best person to advise you on that is the eye specialist lah. Really, the percentage of the op and all that, because since they are the eye specialists, they will know best and they can actually diagnose how many percent of your cataract or how much damage is done lah. Yeah.
Because I just find that my area is quite a lot of older folks like me. Sometimes I find most of them, after doing the cataract, they were very good. They can see everything. Then you can find a few which all come out, all cannot be.
Yeah. So the best person to advise you is a doctor lah. I'm afraid. Yeah.
Okay.
Okay, Miss Esther, you raised your hand. Can I?
Yes.
Yes.
I think I have 3 to 4 questions if the time permit. But
Okay.
my number one question in relation to eye care, there's a big concern here. Okay, what happened is that I have quite a series of Zoom sessions per day. It averages out to 3 Zoom to the maximum 4 Zoom in a day. So it could be morning, afternoon, night, 2 Zoom, or morning 2 Zoom, then afternoon, night. I've been doing that for many months. Last year, towards end of last year, I really got a burnout. My eyes vision affected. So I took a rest until February. So March, I only zooming to a course, a training course. I got no choice, cannot avoid. So it's only April that I came back to Silver Creek because I had to put priority. What happened is, I want to ask, with a lot of Zoom session from Monday till Sunday, right? Continuously, right? How do I take better care? I think I overlooked that until I started to have symptoms of eyesight problem. For example, lately I'm very concerned. That's why I'm so glad you have it on today. Like for example, if I watch TV, what will happen is that my right eye, like a circle, I will see 10 or more circles. So can you imagine the vision? And although I got a new pair of eyeglasses, it does not help. Then the next day, it may shift to my left eye. Then my right eye is okay. It's been going on like that for this month. I'm very concerned. That's why I don't intend to Zoom so much again. What would you advise regarding the eye care? How to do the eye exercises? I remember my children when they were young in school, they were taught how to prevent myopia using the eye exercises. When I asked them, they are now adult, they can't remember. And then also my next question, right, would be like, if you think you know the symptom of my this funny vision with a lot of shadows, that means one circle can have 4 to 10 images, the same image. And can you imagine if you watch TV, wow, the whole thing blur, you know? Then I got to cover one eye, which can see clearly, but the other eye cannot see clearly. Then they say the eye change side, become one side see clearly, switch to cannot see the next day. So I'm very concerned because I just started Zooming again with some training courses. Now, the third question that I want to relate is with regard to the gentleman, I can't remember his name, and Christina Au, regarding cataract, right? So does it mean that once you have the cataract operation, it's once for all, you will not have a recurrence? Will there be a possible recurrence? And the fourth question is like what I told your colleague, the admin staff, that you know, I'm very interested to know how to get the best discount from the eye specialist. What are the procedure? Just now I heard the gentleman mentioned he went to polyclinic and get a letter of recommendation, but he's very rich now because insurance pay for him. I don't have that luxury. And I'm a senior. Right now, I'm not working because of COVID, and I'm very tight financially. So I need to get the best subsidized rate. And my concern is that as a subsidized patient, right, sometimes you don't get the best, you know what I mean? Sometimes you just only get those practicing doctor. Of course, they work in a chain. How best to get a better care from the doctor?
Okay.
Sorry, it's not trying to fish info from you, but I got bad experiences from the team, especially those learning doctors, you know.
Yeah, okay. It's okay. Thank you so much for all the 4 questions. So let me just answer one by one, okay?
Yeah,
so
sure.
your first question is you've been Zooming a lot and you realize that you know your eyes starts to give you problems, right?
Yes.
You have blurred vision. Can I ask, have you did you undergo any eye checkup?
Not yet, because in January, right, I sprained my lower back. It was so bad that I couldn't walk properly, but now okay already. That's why I'm considering going for eye checkup. And also in February, remember the overwhelming COVID cases where GP, doctors, polyclinic, and the MP say if you got COVID, very mild or asymptomatic, stay at home, don't see doctor. Remember the protocol 1 to 3? I was so shocked. Yes, they don't see doctor. Okay, then I don't go.
Okay. So the best person, again, I stress the best person to actually give you to diagnose your condition if you're worried, right, is of course the doctor themselves, the eye specialist themselves. Okay, so about the eye exercises that you see after you watch Zoom and all that. So what do you do? Okay, so as I mentioned previously, and as my colleague Nazura mentioned previously, of course you need to take breaks in between, right? You need to
No, back to back sometimes, you know.
But when you mute yourself or maybe off your video, you can look a while outside the window, just for a break. You look outside the window, the trees, a bit of greeneries. It helps, at least like maybe 5 minutes. Like for now, I'm talking to you. Then probably maybe I just need to look one side at the window at the trees, just to help me rest my eye a bit. Of course, if in conditions whereby you need to present meeting all the time, there's no way that you can actually even relax or breathe, right? So what you can do, right, is to at least blink your eye, when you need to present a meeting. So what?
No, I'm not a presenter. I'm taking more of like I'm a student, so I enroll for a lot of training courses. At the same time, Silver Creek got so many wonderful courses. I love them, but unfortunately, I cut them down the last 3 months because I have to wait and decide on the most important. Because when I first started, right, I come back to the Zoom. I try to Zoom only one day once. But unfortunately, again, I realized it's going to be every day. But at least now I try to cut down to one day once. Last time it's Monday to Sunday, average 3 to 4 Zoom. And it's back to back, so I got no break leh.
Okay, so during the teaching itself, since you're not the presenter, right? So during
I'm not a student.
Okay, if you are a student, so what I can do, maybe you take, is your computer near your window?
Not really. I changed direction. I could see some green trees.
Yeah, correct.
Because I'm living behind the another block lah, but not directly near Mount Faber lah. But I could see the at the bottom, it's at the bottom of Mount Faber.
Wow.
I could see all the greenery there.
Yeah,
but that is in the kitchen.
Yeah, so the most important thing, Miss Esther, right, is to take breaks in between. Taking break doesn't mean you need to get out from your seat or maybe get off the Zoom. So taking breaks meaning, just blinking of an eye, looking out of the window, or maybe standing up for a stretch, all this kind of thing.
I'm sure by blinking your eye.
Yeah.
How long do you blink? How many times?
When you blink, right? So you're asking. This is one of the eye exercises as well. Blinking of the eye, one, just to at least 10 times. Just to at least give your eye a break. Blinking of the eye, or maybe you can rub, your temple. Just rub a temple. Another thing, have you tried blue light lenses, blue light specs?
Never heard before. What is blue light?
Blue light, right, will helps you to actually reduce the screen brightness, the computer brightness, and then reduce you from having headache, and at least reduce your eye from being so tired. So these blue light specs, right, can be found in pharmacy lah. I have seen one in Guardian before.
How about optician?
Optician, you can ask them. Some opticians have it, some opticians don't have it. Blue light specs.
But you see, I have astigmatism, short-sightedness, and long-sightedness. So my optician made a 3-in-1 for me: long vision, short vision. But with this blue light, how do I? Is it a separate eyeglasses or what?
Maybe if you go to your optician, some opticians, they have like 4-in-1, 5-in-1 lenses. But for the price range, I'm not so sure about that lah. So, but then again, if you ask me, blue light specs, and then rest in between the eyes, and look at greeneries, that kind of thing. Stand for a stretch, when you stand, because since you are the student, right? So when your teacher is teaching, right, you can probably off your video for a while, maybe stand for a stretch. So when you stretch, you can actually rest your eyes a while, rest your eyes and look outside at the greeneries. Somehow it will actually reduce your eye tiredness. And of course, the most important thing, the best person, if you have already encountered difficulty in looking, you already mentioned that you have your eyes is giving you problems. The best way is to seek to go for a polyclinic to actually get the doctor review. And then if you are worried about the price itself, just now you were asking about the amount to see an eye specialist, right?
Yeah.
Yeah. So when you go polyclinic with a referral letter to eye center, they will give you a subsidized rate. And if a subsidized rate with a referral letter from polyclinic. And if let's say,
hang on. I got Merdeka Generation card and a CHAS card. Which one is better?
Merdeka Generation has more subsidy. Yeah, but of course, if you want to see an eye specialist in eye center, you need the memo from polyclinic, or to actually give you a subsidized rate. And however, if you go to eye center and you still see, alamak, so expensive, I'm not sure whether I can pay it, inform the doctor or inform probably the reception in front. The doctor most likely will refer you to a social worker that is specialized in eye center, and they will actually advise you accordingly. So the best thing, if you think that relaxing your eye doesn't help, especially for the eye zoom thing, right? So the best thing, if you want to know what medical eye condition are you having, then the best solution, of course, is to seek help from a doctor and to seek their advice. Hopefully there is nothing serious. Yeah.
Because my optician last year, when I went to ask her check my eyesight, she also noticed something very weird. One moment I see it, you know, when they wanted to do a new pair of specs, right? They will check your eyesight, then they will slip on that small little piece of glass, ask you to look clear or not. Not clear, they slip another one. One moment is clear, next moment is not clear. It started last year. So I suspect, could it be a degeneration of muscle? Like just now, I asked you, how come one circle? Last time in the past, because of astigmatism, it's kind of shadow. But this time around, like 1 0 become 10 0. So many shadow behind. What is this actually?
Yeah, so again, my best advice to you is to seek a doctor's advice. For the reason being, right, for the doctor to actually know what you're having is to go through for a comprehensive dilated eye checkup. So for an optician itself, they can check your eyes, they can check how much degrees you have to a certain extent, but they cannot give you they cannot dilate your eyes to see what is wrong inside your eye. So for an eye specialist, they can actually dilate your eyes and see what is wrong inside your eyes. So the eye specialist is the best person to actually advise you on what to do and what kind of condition you're having. Yeah.
Sure. I will do that. I think, thank you for your recommendation. So I will go polyclinic, but they need to send me to specialists, right?
Correct. So if you go polyclinic, you tell the doctor that this is worrying me, and the doctor will give you a referral to go eye center, and with that, you can get a subsidized rate in eye center. Yeah.
Okay. So this medical generation can get better subsidies at eye center. How about making a spec? Will the eye specialist recommend an optician who can make a new pair of specs at a subsidized rate?
So what normally the eye specialist will do, okay, they will give you like a prescription for you to, I don't think I'm sure they have a list of optician that can give you a so-called a good pricing, but I'm not sure if it's advisable for them to give, but they will definitely give you a prescription. They'll print out for you a new prescription for you to bring to the optician. So when after discussing with the eye doctor, and the doctor thinks, oh, okay, Madam Esther, you have this, okay, bring this to the optician, and this is the prescription to make a new glasses for the optician. If you want, you can go to your previous optician, and then probably, who knows, you don't even need to change the frame, you just need to change the lens. Yeah.
Oh, because I was told by previous optician that I'm not able to have a new lens because he need to change both the lens and the frame.
Oh, okay.
And now I pay few $100 not cheap because I appeal. I say I don't have money to pay for both. Please make me a lens according to the previous frame. Then he said cannot. Okay. So I don't know. So that's why now I'm asking you, can I get a subsidized price? Because not only I need reading glass, I need the 3-in-1 very expensive, 4-in-1 very expensive. Few $100.
I know. So Miss Esther, right? So the only thing that I can advise you again is to probably seek a doctor's advice first. Get yourself diagnosed first, and then we see what's the problem. You might not even need to change your lens. Okay. Yeah. Yeah. So that's the best advice that I can give you, since it's bothering you, and you say that, oh no, I feel that it's getting worse. So you better to go polyclinic, get a referral, get a subsidy, and if you still think that the price is too high for you to pay, maybe you can get them to refer you to a social worker, or you can ask the doctor, like when you're over there, I'm sure they have contacts. You just ask them, where I can get subsidized specs or not, that kind of thing. Yeah.
Sure. Thanks for your tip. And then my last question regarding recurrence of
cataract.
cataract.
Okay. So as I've already advised Miss Christina and Mr. Yap, so my advice is I do not dare to say that, oh, okay, there won't be a recurrence, because again, cataract come with age, you know, and it also depends on individual. Some patients, once they go for cataract surgery, it did not come back. But some patients, we have seen recurrence of cataract. So again, this one, that's why we seek the importance of a yearly eye checkup lah, just to prevent all this recurrence. Yeah.
Okay, with regard to cataract, my last question, that is, will zooming so often aggravate cataract if it is already in existence? Of course, right now I don't have this cataract symptom that you described, but if I continue to zoom a lot, let's say later down the road, will it affect the forming of cataract or affect existing cataract in the beginning of formation?
Okay, for patients with cataract, right, I don't think they want to zoom so much also, because the eye itself has they see it as cloudy, you know, like a blurred vision. So going through zoom frequently, right, I think will affect their vision more. So I wouldn't dare to say that, oh no, because when you zoom a lot, then you will have cataract. Then I will give the wrong information. So for people who have cataract, right, normally we will advise them to seek medical advice with the doctor, and then follow what the doctor advised them to do lah, you know, go for surgery or maybe instill eye drops, you know, all this kind of thing. But if you ask me, like, will it get the cataract worse? Of course, in every eye condition, if you aggravate it, you know, like how my colleague actually mentioned with the eye care, you know, you need to rest your eyes, the bigger the screen, you need to sit further back. Of course, if you aggravate all this, then your eye condition will get worse lah. Yeah.
Oh yeah, I got one burning question I overlooked. Is it okay? I just want to ask you, whether is it true that red wolfberry improve eyesight, because my former ex-neighbor actually used to wear glasses. Okay, one day I saw him without glasses. He said he got perfect eyesight now. So I asked him, wow, what do you do to get this miracle? He told me every day he will eat 5 pieces of red wolfberry consistently for a period of time. Then he found that he got back his vision. And it's true, no, he never wear glasses since the last time I saw him.
Okay, so Miss Esther, right, in every thing, like maybe a treatment, right, we will normally
not a treatment, no. Red wolfberry is like a red date, you know, but very small, tiny one.
Correct, because for every patient or every seniors, right, we do not know what kind of medical condition that they have, correct? So we have to take things in moderation. But so far, honestly, I have not really heard red wolfberry as curing eyesight. But probably it does help in because it's probably an antioxidant, like how my colleague has mentioned. It's an acting antioxidant that helps, you know, with the eyes. But curing a medical condition, I don't think so, I'm afraid.
You mean poor eyesight is called medical condition?
Poor eyesight can be so many things. Poor eyesight could be you have long-sightedness, short-sightedness, or medical eye condition, like how I said just now, you know, the glaucoma, the diabetic retinopathy. Cataract is also a medical condition. It's an eye medical condition. Yeah.
Oh, okay. Now I know better. Thank you so much for all your patience. Really appreciate all the answers.
You're welcome, Miss Esther.
Thank you, Siti and Nazura, for the sharing and all the questions from the ground. Just to check, I understand that Cecilia also put in a question regarding, let me see here. Yeah, she had a question, and I believe that our colleague, Nurse Fadila, has actually answered it. Just to check, Cecilia, are you okay with the answer, or do you need us to actually explain to you further?
Apa dia? Wait, what is that? Which?
Yeah.
Oh, okay. So too much answering too much of eye drop. Okay, of course, everything needs to be taken in moderation, and like how the video mentioned, right? Each eye is supposed to be administered according to what the doctor prescribed you, right? So obviously, normally when the doctor give you eye drop, depends on what kind of eye drop. If you're telling me IMO, the normal diluted eye drop, then no, we do not. Oh, okay. Is it okay, Cecilia? You are okay? Can. So I hope my colleague has answered your question. Yeah.
Okay.
Can I ask one question?
Yes, yes.
When you wear sunglasses, is there any difference between the green and the brown sunglasses?
Green and the brown sunglasses. I think basically all sunglasses are the same, but depends on how much UV coverage are they covering. Yeah, because some glasses they are just helping you to keep it dark, you know, just prevent the sunlight from the glaring in your eyes. And some sunglasses also will protect the UV light from the sun. So it depends on what kind of sunglasses that you're having.
But the normal one, is it better use the what color one, brown or green one?
Actually, the color doesn't make a difference
The
actually.
vision make coloring the color one because of our eyesight.
Yeah, color doesn't
Next time I ask the doctor the sunglasses is better for people who had op. They must have a definite color. I think maybe green is better, right?
Okay, so for people going for eye op, especially, you know, like cataract and all that, the doctor normally advise you to cover the affected eye for at least 1 week. This is
I mean after the op, post op. I would advise what color sunglasses to wear. Sometimes you wear green, sometimes you wear brown, sometimes people wear black. They must,
okay, I have seen patients wearing black sunglasses. For the reason being, after eye op, right, we do not want to strain the eye from the sun, from the brightness of the sun, the sunlight. So that's why the darker the glasses, the better. Yeah.
But then it will be too dark, and then you walk, you cannot see properly, you fall down.
No, you just wear it when it's very, very bright under sunlight. Yeah.
Yeah, just that I would just want to know the interest, the different colors that we should wear. I know that we need to wear very dark when the eye is affecting sunlight, but normal person, you should wear what color sunglasses should be more suitable.
Yeah, so the main aim is to keep and avoid sunlight when you are having surgery, you know, post-op or for any eye surgery, right, you go through. The best advice is to actually avoid the sunlight for at least a week. So if you're asking me for a normal person which color is better, of course I would just say that actually doesn't make much of a difference which color cover, but of course for a person who has undergone eye surgery, the darker shade of glasses is better.
Okay, thank you, Siti. I believe for if operation, then you will have to seek the doctor's recommendation on which color to use the best. Perhaps different procedure, they will give different colors as well. But however, for if normal, if you're just going out and want to wear sunglasses, just do take note when you purchase the sunglasses. Just make sure that you have the UV 400. So that's the way for you to actually protect your eyes. So for operation wise, I think it's best to actually seek the nurses or the doctor's advice depending on which surgery you're actually undergoing as well. Okay, so
Miss, may I ask you, in the morning before 9 a.m., is it okay not to wear the sunglasses to protect the eyes?
You mean at home or when you're going out?
Going out, stadium.
When I'm going finish already, I ask question finish and going out with 3 o'clock. Finish there? Yeah. Then why you block?
Miss Christina?
Hello, I can't hear you. Please.
Okay, hi. So if you think that the light is glaring on you, right? Then it's too bright, then yeah, of course you have to wear the sunglasses lah. If it's not if you think 9 a.m. the sunlight, you know, like sometimes it's very cloudy, right? So when it's cloudy, then it's up, you don't need to wear lah. But if you think that, you know, when you go out and then you have difficulty looking and it's so bright that you cannot even open up your eyes, then I think it's better to wear the sunglasses. Yeah.
So, but like normal, usually I go out at about 7 something, then when I return back it's about 9. So I saw people wear sunglasses, so I wonder whether I should wear. If I feel okay, it's okay, right?
Yeah, correct, yes.
Okay, thank you very much. Happy to share your answer. Thank you.
Thank you.
Thank you, Siti, for the questions, and Nazura, and also as well as Fadila, who was helping us with the backend support and answering the question in the chat box. So just to take note that like what our colleagues have shared, make sure that you have maintain a balanced diet, then cut down on your unhealthy lifestyle like smoking, and also do check up with your eye doctor regularly. So I know sometimes it's quite expensive, but that is also as part of our health. I think someone mentioned that eyes is very important. If we don't have eyes, we cannot see. So do remember that statement, and then go for your eye checkup frequently. And if you are using computer or watching TV very often, like what Siti mentioned, take a quick 5 to 10 minutes break, look far apart, look at the greens to actually relax your eyes, and try to look as far as possible as you can. Like Miss Esther who stay at Mount Faber, right? Your very good greenery. Go ahead and look up and then relax your eyes for a bit. So
thank you so much. Can I ask one question? When you say go for eye checkup very frequently, what will be the interval? Like 1 year, 3 times, 4 times? What do you mean by frequently?
No lah. Of course, if you do not have any eye condition, it's best to just check a yearly. Then how frequent after yearly, if let's say you go and see a doctor and the doctor advise you, you know Esther, I think you should frequently check, maybe 3-4 months. It depends on what the doctor advise you lah. But
Initial?
Sorry?
Initial? Like for me, I never go before initial.
Okay, then it will be yearly better.
Once a year.
Yes, correct.
Okay. Got it. Thank you.
Welcome.
Okay. So like what I mentioned, do go for your checkup once a year if possible. Otherwise, maybe once every 2 years if you really think. But if you really think your eyes got issues, don't keep until once a year. Go and check and do a frequent check if you really think there's an issue persisting, like blurry of eyesight and all. Okay, so for next week will be our Mandarin version of this topic as well. So it will be on the 18th of April, 2 to 3 p.m. So do join us if you would like to hear the Mandarin version. Otherwise, we will see you on the 25th of April, which will be our Eye Care Series 2. So for this Eye Care series, we have Series 1 and Series 2. So the next Series 2 will be on 25th of April. So you can join us on, I will see all of you at 25th of April. Then without any, if there's no any further question, then once again, thank you all for your participation, and we'll see you all in 2 weeks time. Thank you and bye-bye.
I thank you, Will. Thank you very much. God bless.
Bye.
Bye-bye.
Bye.
Thank you. Bye-bye.
Bye.
Thank you. The whole team really benefit from all your answer. Thank you so much. God bless you all. Bye-bye.
Bye-bye.
Thank you.
Thank you. Bye-bye.
Appreciate. Thank you. Bye-bye.
Rest your eyes every half. Are you right?